Hi, my name's Alex and welcome to the Ambulance Education Centre Rozelle. Today we're going to be talking about Australia's ageing population. However, we're not going to be talking about how it affects our systems and disease processes. What we're instead going to be talking about is how it impacts upon the health system as a whole and how we can use strategy and policy to best prepare ourselves. Before we can move on and effectively plan strategy and policy, we must first understand just how much is Australia's population ageing. If you look at this ABS graph where the darker coloured bars are the projected population, Australia's population age structure is expected to undergo a profound upward change over the next 5 decades, with a considerable rise in the mean and median age of the population. This is anticipated to generate increasing demand upon all tiers of the health system and health-related areas such as ABS, aged care, the economy, and subsequently government spending. When making strategic planning and policy decisions, you have to consider the ageing population as a double impact. This is because the consequences of the aging population is twofold, as it both increases demand and reduces the health system's capacity. In the next 10 years, for instance, as a result of the ageing population, almost half of the qualified health professionals in the areas of medical, allied health and nursing will be approaching, reaching or passing the retirement age. The need for long-term and proactive strategy is further emphasised when you consider the fact that some of these professionals can take over 14 years to train. Consequences such as these illustrate the importance of proactive strategic planning and policy that implements medium to long-term solutions to increase capacity through initiatives such as training and development programs for young staff, flexible retention programs for older staff, and policy changes to reduce the burden of the ageing population on the Australian health system. So we now know that Australia's ageing population will bring about significant increases in the demand for health services. As health managers, we must now ask ourselves, how can we use tools like strategy, like policy, to try and elicit the type of organisational change necessary to meet these rising demands? Thank you for joining us.